Good morning, everybody, and thank you all for coming. My name is Elizabeth Lucas. I have met some of you during our listening tours. I am the State Director for Organizing for America here in Pennsylvania. Thank you for taking the time on a Friday morning to join us and for your flexibility. But what I would like to do, because you're not here to hear from me, is to introduce you to Pennsylvania's longest-serving U.S. Senator, Senator Arlen Specter. The Senator has pleased us very much so with his vote on the stimulus package. Shortly thereafter, he did switch parties. As you all know, we're very grateful to have him in the Democratic Party once again. And without further ado, I would like to introduce Senator Arlen Specter to you all.
Thank you, Elizabeth. I'm working with President Obama on comprehensive health reform. I support the public option. Senator Schumer has. I know there are a lot of questions on your mind, and I'm glad to respond to your questions.
As a former Republican, how do we combat the lies that the Republicans are putting out there about the health care reform? I mean, I saw an ad just last night where they had two retired people out there saying, gee, under this new health plan, the government won't pay for my surgery, but they're going to use my taxes to pay for abortions. And they're using these kind of lies and innuendos to try to get people to turn against the health care plan. How do we combat that?
We have to respond. We have to respond. And we have the facts on our side, and we have to make the case. That's something that I've been doing for a long time, since my days in high school debate. We have to speak up. And I'm a good person to speak up.
Yesterday, I was in discussion over at the Hope Lodge here, and somebody who voted for Obama made the comment. He said, I am really concerned. He's Medicare, I mean, like myself. He said, I'm concerned by extending health care benefits to the homeless, to the poor, to the uninsured, is going to be at the cost of my choice, my benefits. Is there any truth to that?
No. Well, the whole point is to cover the 47 million Americans now not covered, and to deal with the rising costs. Those are the principles of what President Obama wants to do. Listen, we have enough doctors and hospitals and pharmaceutical equipment that if we work out the delivery system, we can do that.
People are attacking the public option, saying it would be more expensive. It is much more efficient. Medicare is much more efficient than private insurance.
Well, you put your finger on it, the costs of the public option, and that's what President Obama has said he wants the public option for, as he put it bluntly, to keep the insurance companies honest. Let me thank you for what you have done to help elect President Obama. Let me thank you for staying active in the field, because there's a lot more to do beyond the election. The president is taking his case to the people, and I'm trying to help him. And a big part of what we do is to inform the public. These polls are very important as to how people feel. And people's feelings about these various issues depend upon what they know. And you are all activists, and there's nothing like word of mouth. Thank you all very much. Thank you, Elizabeth. Thank you.